Who can participate in care court? In this video, you will learn the requirements that must be met to participate in care court. What is care court? The Community Assistance, Recovery, and Empowerment Act, CARE Act, is a new law that created a new court process to help people with certain mental health disorders connect with a range of services. Services may include medical and mental health care, social services, and in some instances, housing assistance. This court process is called care court. In care court, the person asking for help on behalf of another person or for themselves is called a petitioner. The person that needs help is called the respondent. Not everyone that wants to be a petitioner or that may benefit from being a respondent can participate in care court. A petitioner must meet all the following requirements. 1. Be 18 years of age or older, and 2. Be related to the respondent or know them in one of a few specific ways. The respondent's parent, spouse, sibling, child, grandparent, or roommate may be petitioners. The following service providers may also be petitioners. 1. Homeless outreach worker. 2. Medical professional treating or who has recently treated the respondent. 3. Public service agencies, and 4. First responders who have had repeated contact with the respondent. Similarly, not everyone with a mental health disorder qualifies to participate in care court. To participate, the respondent must meet all the following requirements. 1. Be 18 years of age or older. 2. Have a diagnosis of schizophrenia or other psychotic disorder. The following illnesses alone do not meet this requirement. Other serious mental illness, such as major depression or bipolar disorder. Substance abuse and related symptoms. 3. Have symptoms that are severe in degree. Severe symptoms may include behaviors like delusions, hallucinations, or unusual mood changes. Delusions are constant and false beliefs about what is happening to the person. For example, believing that someone intends to harm them in some way. Hallucinations are when an individual hears or sees something that is not there. For example, if the person says they hear voices. 4. The severe symptoms are currently present and may last some time. Examples of symptoms that may be present and last some time may include difficulty with self-care tasks such as bathing and grooming. Difficulty maintaining a residence, using transportation, or managing money. Difficulty creating and maintaining relationships. 5. The severe symptoms cause behaviors that affect basic daily activities. For example, if the person is unable to complete self-care tasks, they may not be able to maintain a job. Similarly, if the person is unable to manage money, they may be unable to pay for or arrange transportation to and from work or purchase work-appropriate clothing. 6. The severe symptoms cannot be managed without treatment, support, and rehabilitation for a long time. For example, if a person is unable to complete self-care tasks, has repeatedly tried to establish and maintain their own household, but has a history of losing their home because they are unable to keep their unit in sanitary condition. However, when they have been receiving necessary medical care and taking medication as prescribed, they have not had these issues and maintained their household for extended periods of time. 7. Not stabilized with ongoing voluntary outpatient treatment. For example, the person refuses to accept treatment or accepts treatment, but then refuses to continue. 8. One of these must be true. A. The person is unlikely to survive safely or independently in the community, and the condition is worsening, or B. Services and support are needed to prevent relapse or deterioration. An example of someone unlikely to survive safely or independently may be recent or frequent hospitalizations due to symptoms. An example of someone needing services and support to prevent relapse or deterioration is someone who has access to immediate and safe housing, but repeatedly chooses to be homeless. 9. Participation in care court is the least restrictive option. Examples of less restrictive options that the respondent may have include voluntary agreement to go to the hospital for care or take prescribed medication as directed by their doctor. 10. The person will likely benefit from participating. Examples of someone who will likely benefit from participating is someone who has a history of being stabilized when attending medical appointments or fully capable of completing self-care tasks when taking prescribed medication as directed. To summarize, the person needing help must meet all the following requirements. 1. Be 18 years of age or older. 2. Have a diagnosis of schizophrenia or other psychotic disorder. 3. Have symptoms that are severe in degree. 4. The severe symptoms are currently present and may last some time. 5. The severe symptoms cause behaviors that affect basic daily activities. 6. The severe symptoms cannot be managed without treatment, support, and rehabilitation for a long time. 7. Not stabilized with ongoing voluntary outpatient treatment. 8. One of these must be true. A. The person is unlikely to survive safely or independently in the community, and the condition is worsening, or B. Services and support are needed to prevent relapse or deterioration. 9. Participation in care court is the least restrictive option. 10. The person will likely benefit from participating. The petitioner must show the court that each of these requirements are met by completing Form Care 100 petition to commence Care Act proceedings in full and with as much detail as possible. Other resources. The petitioner may contact the Orange County Health Care Agency directly to learn about other resources that may be available for the respondent. The Orange County Health Care Agency may be reached at 1-855-625-4657 or www.ocnavigator.org. Remember, although there are a lot of requirements to meet, the Orange County Superior Court Self-Help Care Court Specialist is here to help you. Learn more about how the Care Court Specialist can help you by watching a short video found at this website.